Okay, thank you for joining me, everyone. Welcome to the show. And we're talking health today. My guest is Dr. Edward Fatakhov. He's with the Center for Internal and Integrative Medicine. Edward, thanks for joining me today.
Yeah, thanks for having me to be on your show.
You're welcome. I mean, obviously, we're talking about a most fundamental issue here, which is how one can have an optimal diet for health. Certainly, something that anybody who looks at me knows I've had struggles with. But let me start by giving us, if you don't mind, somewhat of a philosophical overview of what you recommend.
Sure. In terms of diet, I don't believe in diet. When you say the word diet, 95% of patients fail according to studies. So mine's more of a lifestyle approach. Think about it this way. People who are vegan, when they wake up every morning, they're not dieting. That's a way of life. Now, if I go up to a vegan person and say, hey, eat a double hamburger with bacon and cheese, they're going to look at me like I'm crazy.
Right.
That's the same concept if I go to somebody who's eating the standard American diet and I tell them, eat kale soup in the morning, they're going to look at me like I'm crazy. So the thing is, we have to find out the foods you love to eat, tweak it, make it more healthier. It just happens that the vegans are eating healthier, but they're not on a diet. It's a way of life. So the two questions I pose to all my patients that come into my clinic, the ones I just saw like right before I started this, was one, would you recommend this diet to your children? And if the answer is no, and you don't think it's healthy enough for your child, then why are you doing it? And the second question I pose is, can you do this for the rest of your life? Oh, no, no, doc, I'm just gonna do it for 6 months. What's the point of doing it? You're gonna gain the weight back. And that's how you have this yo-yo dieting, because they'll see a new trend and they'll bone broth diet or this diet or that diet, they jump on and they lose the weight. All diets work in their own respective because you're either calorie restricting, you're changing your foods, you're increasing metabolism, you're doing stuff in that program that works because it's healthier than what you're doing. The problem is when you stop that, you gain it all back. So there's something you're doing in your behavior or your lifestyle that's causing you to gain the weight back. So my goal is just to kind of tweak and find out what's the issue.
Okay, so then you're talking about an overall philosophy here as opposed to like a flat diet. And
Right.
I could just tell you, my situation lately is that I've put on a lot of weight over the past several years, and I now take a very tiny blood pressure pill and a
Mm-hmm.
very small dose of cholesterol.
Mm-hmm.
My family, there's a history of heart condition, so I have to be very careful about that. And I wasn't feeling well, and my doctor basically told me, along with that, that I had to lose about 20, 25 pounds, and that the way to do that was to go to a very low carbohydrate diet, that to eliminate pasta, eliminate bread, eliminate potatoes, eliminate anything that's starchy and carbohydrate oriented, and just go to a high protein diet, and which will result in my having less cravings for sugar and also reducing of dairy. And I've done it. And I'm doing it now for about maybe 2 months. I've lost about 10 pounds. And I think so far so good in that, I don't feel deprived. I can still go out and have a really big omelet in the morning, with cheese and everything. I just don't have the potatoes and I don't have the bread. Is this going to be good for me in the long run?
Well, that's actually a great question. So people are doing high protein diets, low carb diets. I just published an article. People that are starting at a middle age, right? So later in life, actually have a higher mortality later in life. So
Okay.
from what the recent study, this was about a month ago, it doesn't look as promising. Two, whenever you're depleting yourself of carbohydrates, right? So when people say carbs, are they bad? You know, it's what kind of carbs you're consuming, right? So if you're doing fiber or dense, rich nutrition carbohydrates like quinoa or sweet potato or brown rice or couscous or cauliflower rice, that's a healthier starch, right? It's a complex carbohydrate. So the fact that you lost 10 pounds, I could probably say some of that weight is because of water weight, right? So whenever you consume carbohydrates, it fills up with water. When you actually start consuming protein, you actually get dehydrated and actually pee out a lot of the water. So a lot of it is fluctuation in the water weight because carbohydrates fill you up. Now, if you feel better and your labs are better, if you're eating more protein that's got more fat in it, is your cholesterol going to get higher, right? Are you at more risk for colon cancer because of high protein, depending if it's animal product protein, non-animal protein. So the way I look at it is calories for carbs and calories for protein, they're exact same calories, right? It's 4 kilocalories. So even if you eat too much protein, which if you are doing right now, that protein gets converted to carbohydrates.
I
So
see.
what's the difference? The fact that you're eating, $30 steak versus a $1 potato in your body, it's still going to be used as carbohydrates because your body can't store protein. So if it can't store protein, it converts it to carbohydrates versus carbohydrates can be stored in the liver and in the muscle as glycogen. So the fact that you're not absorbing all the protein, you're actually converting it to carbohydrates. It's just an expensive way of getting your carbs, is the way I look at it.
Oh, okay. I mean, I also eat very little red meat. It's mostly fowl and fish. Um, and I certainly get that. I think that once I reach a certain weight goal, I'm going to probably go back to some of the more healthier carbohydrates, as you say, like unprocessed brown rice and quinoa and that kind of thing. But I'm going to stay. I'm staying the course until I reach that goal. Um,
Yeah.
it's just a matter of I'm very determined, to
Well,
get there.
it's the determination, but the way I see it is just as long as you're happy during the journey that you're doing it, that's fine. But a lot of people that I see that come to my clinic is they're miserable, they're keeping a diary, they're starving, they're cranky. So, if you're dieting or you're on under a meal restriction plan or a calorie deficit and you're miserable, you probably shouldn't be on that plan. Now, if
Right.
you're like, I feel great, I don't mind eating this, this doesn't affect my life, I go about it, then yeah, keep doing it. But if it's something where you're like, I can't wait to get off of this. I hate this. I want to go out, and then you're getting depressed, or you're having cravings
It's
for
not going
food.
to make it. Yeah, it's good. Well, that's one of the things that appeals to me with this diet, and that I can have a lot of food. I mean, if that's what I want to do, as long as it's proteins. Um, I also was very struck by a comment made by radio talk show host Rush Limbaugh, who has struggled with weight all his adult life. He was very, very heavy, and then he would yo-yo, and he tried every kind of diet you could have, and eventually he did lose all of the weight, and he's kept it off all these years. And he said that the thing that he realized that led him to weight loss was that he had to tolerate the fact that he was going to be hungry. He had to learn, like, we stuff ourselves. We can't tolerate the experience of hunger. And it's not like you're going to starve to death in this country. You're going to get food. But if you can learn to experience a little hunger every day, which is normal, it's actually healthy because the body burns off fat and all the stored, you're not going to starve. You could probably, somebody of my weight, I could probably get by without food for 2 weeks and be fine. Starvation won't set in for probably until 2 weeks.
But
So I've taken that also to heart. And when I experience hunger in the course of a day, I don't get panicky. I did not like I did before, but we have an immediate impulse. Oh, I can eat. Oh my God! I just, I go with it. I tolerate it, and I just relax about it. And I think that helps.
but knowing that, they've done research on that, right? So they take people, that's how we got obesity as a disease, right? It's now considered a disease because they realize that it's a chronic condition, like blood pressure, like diabetes, like cholesterol. It's actual disease. So they actually followed people that for 5 years out, and they checked their hormone levels with diet, proper nutrition, and health. Um, and what they found was that after 5 years of checking their hormones, no matter how motivated these people were, no matter how much they worked out, they ate healthy, they did everything as their other counterpart, they gained all the weight back. And what they realized was, after checking their hormones, is that their hunger hormones were way off the roof. They had no metabolism. Their metabolism was shot. So the fact that you're saying Rush Limbaugh is always hungry, it's not him. It's the ghrelin hormone that's increased because of the weight loss he's lost. And so it's a constant battle. And you'll watch, sooner or later, we call it a metabolic adaptation, he's going to gain the weight back because his hormones just keep rising and rising and rising to the point where sometimes we need medical intervention medications, because at that point it's not his fault. It's a disease, and the hormones are rising, the metabolism is shot, it's not moving. So what do you do at that point, right? Because you're motivated, you're excited, you have a trainer, you're eating healthy, but the hunger just succumbs so high based on the studies of the hormones that you're going to end up eating more than you're supposed to. Whether it's 2 years out, 3 years out, 5 years out, it will happen unless you're really good at controlling those hunger urges.
Well, it's as I like to tell my family, it's my war against carbohydrates. It's every day. I'm in the trenches. Doesn't mean I'll win every battle, but I hope to win the bigger war. Um, do you recommend any particular, not medication, and I don't mean like a prescription, because I think that those and the doctor at Mass General, where I go, she gave me several medications that she could recommend, and none of them were good. They all have terrible side effects, and I don't want to. They're not really made for diet. They're other kinds of drugs. But I am doing some natural things. I am taking some natural supplements. I'm taking like a fat burner, and I'm taking some stuff that I see out there. Do you recommend anything in that? I mean, first of all, as a prescription, but also something that you could buy like at Whole Foods or something over the counter?
Yeah, that's actually a great question. So in terms of studies, all my patients, when they walk in, I tell them, are you on a probiotic? Studies have shown probiotics have an average of 10-pound weight loss.
Wow.
So it's in a 6-week trial. And there's certain strains that help with weight loss. They're actually doing in Harvard fecal transplant studies where they're taking feces from a family member and transplanting them to people who are obese and seeing how that helps with the weight loss with the gut microbes. So if you're a patient that's not eating healthy and you're not a probiotic, why not? Because that's the initial 10-pound weight loss. 2, what I recommend is 5-HTP. They've done studies. 5-HTP is tryptophan, the stuff they kill the turkeys with, right? So that's why during Thanksgiving you feel tired, you feel cold.
Wait. Just slow down for a minute. I want to take a few notes here. So probiotics, and what is the other one?
5-HTP, 5-hydroxytryptophan.
5-HTP. I'm taking this. Hey, I'm learning here. HTP.
Yeah.
Okay.
And
all right. Please continue.
when they did the study, they showed 50 to 75 milligrams per day helped curb the appetite, helped with the feeling of fullness.
Okay.
And not only that, they did a study actually with apple cider vinegar with 85 Japanese women, and it showed that over a course of 6 to 8 weeks, they lost an average of 5 to 7 pounds with 1 tablespoon of apple cider vinegar a day.
Oh, okay. I did try that one also. The with that popular brand that I see advertised everywhere. And then I took, along with that, I took this Garcinia, which I don't know. I took it because I figured if it helps Ivanka Trump lose weight, it could help me, but it didn't work that way. But the apple cider vinegar, I think, is a sensible, natural thing to do. What about, and this is not something that I'm considering, but there is someone in my family that is, and that is the surgery, the bariatric, which to me seems like an extreme thing to do. But if someone really is at the end of their rope, what do you think of that?
So unless they've tried everything with, I basically, bariatric surgery is this last resort. I will hold off to it to last minute. Because here's what happens. When you do the bariatric surgery, the gastric sleeve, you're basically taking away the cells, the ghrelin cells that control the appetite, the hunger, right? The hunger hormone. What they realized 2 years after the surgery, after the gastric sleeve, the ghrelin that they took out, the few cells that were there are actually producing more ghrelin hormone than what you had before the surgery. So that's why you see people 2-3 years out after bariatric surgery gaining all the weight back. And I have plenty of patients in my clinic that had revisions in bariatric surgery, and guess what? They're heavier, or if not the same weight, but now they're having more problems, right? They're having iron deficiency, vitamin deficiencies, they're having absorption problems, gut problems. So to me, it's like if you've tried everything out on the market and you really pushed it and there's nothing else you can do as bariatric surgery as a last viable step, then I'm all for it. But I'm very hesitant to send somebody bariatric surgery unless they absolutely have failed everything. Because even with the surgery, you might gain all the weight back because of the hormones, right? It's all about hormones and metabolic adaptation. So the fact that you took that out doesn't stop your brain from saying, I'm hungry, because the hormones is being produced.
And also, it seems like a really extreme measure. You're literally having 2/3 of your stomach removed.
So think about it like this. It's a great analogy I made the other day about how we treat weight loss in this country, and you'll actually appreciate this. So in the 70s and 60s, when we had high blood pressure, right? You go to the doctor's office, they tell you, look, get on a rice diet. And then you get on the rice diet, and then you come back to your doctor and says, look, I did the rice diet. Okay, no problem. What we'll do is we'll just take out your adrenal glands, we'll cut one of your vagus nerves in the stomach, and we'll take out a kidney. And so the patient said, okay. And the patient would say, okay, now imagine weight loss 20 years from now, right? So where medication is the standard. Now you go to your doctor and you get blood pressure medication. But imagine now if you go to the doctor and say, hey doc, I tried the diet, it doesn't work. Oh, don't worry, we'll take out your kidneys. We'll take out an organ. You'd go to jail. So,
Yeah, right, of course.
but now for weight loss, you go to the doctor's office, they'll say, okay, have you tried diet and exercise? Yeah. Oh, it doesn't work. Okay, well, let's just take out half your organs in your gut and then I'll help you lose weight, right? It sounds normal now, but it'll be barbaric 20 years from now. Like with the blood pressure story that I'm giving you, before there
Right.
was all this research on blood pressure and it was a disease, and even the president, I mean, Eisenhower's blood pressure was in the 200s, right? And
Right.
organ removal, like we took out the adrenal glands, it helped. If we took out the kidneys, it helped. If we cut out this nerve, it helped. But now we actually have approved treatments, but nobody, unless you're end stage blood pressure resistant, will even take out an organ unless it's required. So that's how I look
I
at.
would think. I mean, and also speaking of Eisenhower, I read that one of the reasons he did die, not because I mean, he had health problems anyways, he had heart disease, but there was a dietitian who put him on I don't know if a vegan diet, but it was like a radical change in his diet, where they removed protein and they gave him just like a all vegetable kind of like thing, and he passed away right after that. So I don't know if that's anecdotal, but the body needs a certain amount of fat and a certain amount of protein. I mean that's normal. I mean
Correct.
it seems like when all things are said and done here, you seem to be suggesting, and quite, I think, reasonably, the FDA balanced diet approach, going back to the 1960s, when they used to come out with that plate, and they showed 1/3 protein, 1/3 carbohydrate, and 1/3, I think, vegetable or something, that's the ideal diet.
Yeah, because you want the good fats in there to keep you full, the satiety, right? You want the protein. Basically, the way I say it is if you're getting zero point 0.6 to zero point 0.8 kilograms per body weight of protein, you need that. Here's what I say. If you have that much amount of protein per day, then it really doesn't matter. You're not going to lose muscle. So if you're, let's just say, 150 pounds, right? And you're 70 kgs. So if you get 50 grams of protein, that's what your body requires so you don't lose any muscle and to build muscle, then everything else that's it. That's all you need. So when people get 300 grams of protein, like why? Your body only needs 50 to maintain muscle mass, to keep muscles going for hormones and all that. The other 150 is not going to get absorbed. It's just going to be converted to carbohydrates,
Okay.
right? So if
So
you
no,
follow,
that's interesting. So I didn't really factor that in my diet. So okay, but no magic pill, eh? Nothing I could just go
there's
out.
no. Well, there's some prescription medications that are actually, the studies have been pretty good on it, and I've seen patients lose 50 to 100 pounds on. So there's some new medications on the market that you didn't have a few years ago that I'm seeing some pretty good results. But there's no magic sauce. People want the easy pill, right? They'll do cool sculpting, they'll do all these body sculpting, liposuctions, fat burners,
Sure.
but hormones. Another thing, as you get older, I always look at the hormones, right? So people who had opioid addiction have a testosterone deficiency. So hormones are just as important. If you're just thinking it's exercise and that, and it's not your hormones, it's going to have an issue. So I make sure I check the hormones. And the second thing I do for weight, people who need to lose weight, I look at the medication. Are you taking Benadryl? Are you taking a Zyrtec? Are you taking blood pressure medications that cause weight gain? Are you taking an antidepressant that causes weight gain? Because stopping a certain blood pressure medication that causes weight gain, you could lose 10 pounds. And the doctors, or even the cardiologists or the kidney doctors, don't know which medications cause weight gain and weight loss, right? It's not their job to know. Their job is to protect your kidneys and heart. So they're not looking at it from that angle, and you could switch a medication and get the patient not to gain weight. Or if you put them on an antidepressant, there's antidepressants that help you lose weight, not gain weight. So it's actually also knowing what are they taking in their medicine cabinet, what are the prescription medications, are they on birth control pills, are they on IUD? All that takes a big role into it. Half my job is like, okay, you're on 6 medications that cause weight gain. So the first step we need to do is, before we address what you're eating, let's address the medications.
No, very important. I mean, you're saying this, and I'm thinking about someone I know who is on a lot of medications and who is really in trouble weight-wise, and maybe that they should sit down with a specialist and take a look at each one of them to see if they have a record of weight gain. Now, you also mentioned the proper maintenance of hormones, putting aside whether or not someone has an opioid addiction. How does the average person, especially as they're getting older, regulate the hormones or the proper manufacture of hormones? And is there a magic pill for that?
Yeah, so as you get older, you decrease your amount of hormones, right? Your testosterone, your growth hormone, just natural aging.
Right.
But people who have a stressful lifestyle, right? They're working X amount of hours, they're stressed out at work, they're staying up at night, they're not eating healthy, they're not working out, they have diabetes. Well, those people are going to have the hormones even affected as much too. So exercise helps, right? There've been some studies on intermittent fasting or even good diets that help with increasing growth hormone, testosterone, vitamins, right? So they've done pretty good studies on zinc, magnesium, and vitamin D to increase
Oh yeah.
testosterone. Just
No, I've heard that. I've taken that.
so checking your hormones and see if you're a candidate for hormone therapy, because it'll increase your drive, your muscle mass, it'll help with weight loss too, right? So if you're doing everything you're supposed to, everything correctly, and it's the hormone issue, it doesn't matter if you climb. I mean, you'll climb Mount Everest before you lose a pound of weight because of all the hormones, the abnormalities that you're having. So always get your hormones checked. Talk to your doctor about your thyroid. Talk to your doctor about checking your testosterone or estrogen or progesterone if you're female. Check your adrenal hormones. You'd be surprised how many times I see patients where their testosterone is 50 and they look at me and they're like, well, what's wrong? These are my male patients. I'm like, that's what the levels women have, and they're in shock because they're like, I feel okay. I'm like, you don't know how you feel until you've actually felt normal. And then when I get them to that level, like, wow, I can't believe I lived like that for 10 years. People just get used to the way they live and they just think it becomes normal.
Interesting. No, though. So it's, in a sense, is checking your hormone levels, and checking your medication to see whether or not they could contribute to weight gain. Okay, Dr. Edward Fatakhov, I want to thank you for joining me this afternoon. Could you let my listeners and viewers know where they could get information about your work and about you and about your clinic?
Sure. I'm at the Center for Internal Integrative Medicine here in Alpharetta, Georgia, Atlanta, Georgia. You can find me at drfatakhov.com or www.eddiefatakhovmd.com. I'm also on Twitter under Eddie Fatakhov, on Instagram, Eddie Fatakhov, and on Facebook under Fatakhov. Check out my website. I got plenty of resources. My new book is coming out. It's called Dr. Fatoff. My patients call me Dr. Fatoff. My last name is Fatakhov. A simple, lifelong solution. So it's stuck with me. I figured it'd be appropriate to name the book that. So it's coming out in May.
Well, let me know when you get close to publication. I'd like to do another show.
Yeah, great. Thank you so much for having me on. I really enjoyed it.
Thank you, Eddie. All right, take care.
Take care. Bye.
Bye-bye.